Hi, I am Kelly Scavira, one of the clinical directors at Matrix Medical Network. Thanks for joining our team. We are so glad that you are here. I joined Matrix as a clinician way back in 2012. I served my community for 5 years as a provider in my hometown and all around the county. Then I became a team leader, then a clinical manager, and now clinical director. I love our Matrix mission and vision because it really aligned with my professional mission and vision. I love providing much needed care wherever our patients call home. I like being the expert of all things healthcare in my own community. So no matter where I go, I see someone that I assess, educated, or referred to care, and I get them the care that they need. Family members also recognize me and ask me, when can my mom or dad get another visit from a Matrix clinician? At Matrix, we live and work with integrity, passion, and respect. We are accountable to not only our patients, but to each other. And we trust you to do the right thing every time. I love working at Matrix, as all the levels of the organization want us to succeed. We are committed to being kind, authentic, and honest with you and all your teammates. So before you go out into the field to see patients, we wanted to give you an idea of what you can expect during your visit. So we've created a video that captures all the elements of a comprehensive assessment. This video is quite detailed, covering everything from entering the home to the complete medication review to conducting appropriate screening tests and completing a quality head-to-toe exam. We also highlight a couple of extra scenarios that could come up during your visit, such as the need to refer a patient to community service or an emergent issue, or contacting their PCP. I hope you will find this video to be a helpful demonstration of our internal mantra, which is, we see you, we hear you, and we've got you. And that you will now live that mantra when you start seeing patients, hearing patients, and having the back of every patient. You will make a dramatic difference in their lives. Please know that we want you to be successful, and we want you to stay at Matrix from hire to retire. We've got you, and you've got this. Welcome to Matrix.
Hi, are you Donna? Hi, I'm Danielle from Matrix. How are you?
I'm good.
Good. I'm excited to meet you.
I'm glad to meet you too.
Good. Thank you. So Donna, thank you for letting us come back out to visit you. You've had a visit before with Matrix?
Yes.
Wonderful. And just so you know, these visits are done yearly. And the reason it's different from your doctor wellness visit is because we actually come to the home and assess your environment and make you feel comfortable and just spend an hour with you here in the home. With your permission, if it's okay, we'd like to send a copy of our assessment, which is all confidential, to your primary care doctor, if that's okay. Wonderful. And then can you confirm, are you in hospice care? You don't have any nurses or therapists coming to see you? Wonderful. If it's okay, we're going to collect some health information and review your medications. I'm going to do a head-to-toe physical. And the difference is, you know, we're in your home environment. You should still see your primary care doctor for your annual wellness visit. But a little more relaxed environment here. We have some time to chat, and you can ask me questions if you need anything. And just so you know, everything on my screen is protected with the HIPAA law. And may you verify your birthday for me?
8743.
Wonderful. And do you have your ID and your insurance card with you? You're prepared. Good job. So these visits we generally offer once a year, so you might get to see us again. And then we'll send a copy, like I said, to your primary care doctor. do you have any visits from a nurse or a therapist coming to see you right now in the home? Okay. And are you currently employed?
No, retired.
Okay, retired. What did you do for a living?
RN.
An RN, wonderful. Well, thank you for your service. I'm sure you were wonderful at that. Do you ever miss working?
Yes, sometimes.
Yeah, good. We need nurses.
I know.
And then your primary care doctor, who do you see now?
Dr. Means.
Paul Means.
Mm-hmm.
My sister went to high school with him.
Really?
That's the nice thing about being local. We know some of the doctors.
Yeah, I worked with him.
Yeah, he's a nice man.
Mm-hmm.
Good. And then how about a specialist?
Dr. Evans, Terry Evans.
Okay. And Terry Evans is a specialist in what?
Oncologist.
Okay. And do you have anybody else that you see?
Dr. Danino for heart.
Okay. And where is Dr. Danino located?
Greensburg.
It's your cardiologist.
Mm-hmm.
And how often do you have to visit with Dr. Danino?
Once a year.
Okay. Anybody else you see regularly?
No.
That's enough, huh?
Yeah, that's
Yeah.
enough.
And then, were you in the military at all?
Yes.
You're a veteran? Okay. And do you have a designated power of attorney?
My daughter.
Your daughter, okay. Kelly Green. And do you have a good phone number for Kelly?
724-887.
I'm surprised you have that memorized. We know we keep those numbers in our phone that sometimes
Yeah.
I don't remember. I just have to
know the
push a button.
favorites, hitting buttons.
Yes,
Yeah.
yes, very good. Do you have a living will or an advance directive?
No.
You don't yet. Okay. Have you thought about looking into getting that?
I had looked into it when
Yeah.
I was diagnosed with the leukemia.
Okay. So you can talk to your primary care doctor. Oftentimes they have the forms right in the
Mhm.
office. You may even call your insurance company and they can mail them to you. And are you married?
Yes.
Yeah, and you have children.
Yes.
So sometimes it's a good idea to have those wishes listed out, what you would like if something would happen to you in the case of an emergency where you can't speak for yourself. So I definitely recommend talking to your primary care doctor about that. And I'll write that down as a reminder on the back here so that you can remember. I'll leave these notes for you at the end. That way you can take it to your primary care doctor with you. So every visit, Donna, we do a little cognitive test, just a memory recall,
Mhm.
and see how you do with that. How do you keep your mind stimulated now that you're retired?
I read a lot.
Good.
I read a lot. Go to Bible study and
Wonderful.
you know, things like
You're
that.
still interacting with people and
Oh yeah.
your family's around. That's good.
Mhm.
Good. My grandma used to say, if you don't use it, you lose it.
Yeah, for
Right.
sure.
So definitely glad to see
That's
the
the way I feel about exercise.
Absolutely. Yes, very good, very good. All right, so what I'm going to do is I'm going to give you 3 words that I'd like you to keep in your head.
Okay.
I'm going to give you the 3 words. I'd like you to repeat them back to me.
Okay.
Apple, ball, cup.
Apple, ball, cup.
Good way to remember it, I say, is ABC. Apple, ball, and cup.
Okay.
Good. Now, we'll come back to that and see if you can remember any of those words.
Okay.
As a little distraction, I'm going to start the clock here, and I'd like you to put the face of the clock. So I want you to start and put the numbers all around, just like you would see on a wall clock. Okay, perfect. You hold on to that pen. If the time said 10:45, where would the hands go? That looks wonderful. Your numbers are all in the right place, and your hands are going in the right direction. So very good, very good. Now, with that little distraction, are you able to recall any of the words that I just said to you?
Apple, ball, cup.
You got it. Very good. Definitely keep stimulating your mind. Continue to read, talk on the phone. You check in with everybody, so that's really good. So, Donna, compared to 2 years ago, would you say your physical and mental health is about the same?
About the same. Yeah.
A little better, a little worse?
Slower
Okay.
with activity, but
Yeah, I think that comes as
I
we
go to the
age.
gym like 3 times a week.
Wonderful. How long do you spend at the gym?
An hour. probably.
Perfect. Wonderful. Do you
Yeah.
use like a Silver Sneakers program?
Yeah.
Wonderful.
I do the machines and
Yes,
stuff.
good, good.
Mostly cardiac.
Do you go by yourself or are you with another
I go by
member?
myself, but I know people there.
Yeah, wonderful. Good, good. I'm glad to hear that. If I ask you some questions about your family history, would you be able to answer that? Your mother and father,
Yeah.
sisters and brothers. Good. Okay, so we're going to review this next session. It's a social determinants of health. So you said that you are married and your husband lives here with you.
Perfect. 63 years.
Good.
next
Oh, well,
month.
congratulations. That's rare today.
Yeah.
Very good. And then do you feel safe here in your home?
Oh, yeah.
Okay. Is this all one level, or do you have any steps to go up and down?
We have a basement.
Okay. Do you have a railing to hold on to go up and down? Wonderful. Do you have to go down there often, or just if you need something?
We have a room down there, but we don't really use it. It was, mostly for the kids.
Perfect.
Yeah.
Good. And you have running water, electricity, heat, any issues or struggles with, paying those bills every month? Okay. And how about food? Do you go shopping once a week, every couple
go
weeks?
shopping, a couple times a week probably.
Oh, good. And any struggles with affording the groceries and making sure that you have enough food in the house?
No.
Good. Now, you were a nurse. Were you ever exposed to any environmental hazards, chemicals, fumes, paints that you can recall?
No.
No, really. Okay. And transportation is not a problem. You still drive?
Still drive.
I love that. Good. You wear your seatbelt?
Oh, yeah.
Good. And how about your neighbors? Do you feel comfortable that if you needed help, you could reach out to somebody next to you?
Yes.
Okay. And nobody is threatening you or hurting you or stealing anything from your house that you're aware of?
No.
Okay. Are you a caregiver right now for anybody else? Other than the puppies that you said you have. You have puppies. Good. And then do you have any difficulties with reading or writing? You can read a pamphlet, you read books all the time, so good. Do you ever wear any glasses to help see?
Just reading.
Reading glasses? Okay. And how about any hearing aids
No.
on either side? Okay. All right, the next thing I'd like to go over, and you are so prepared, you have your medications already ready. Do you have a drug allergy that you're aware of?
They said penicillin, penicillins,
Do you remember what happened when you took penicillin?
It was right before I had my heart attack. I had a virus and I was on it. So then when I had the heart attack, I had a rash and they said it was penicillin.
Rash.
So
Okay.
I don't know.
So you just avoid it.
Yes.
Okay, that's smart. All right, and then maybe take a look at the current medications that you're using. Okay, thank you. And do you get your medications from a pharmacy, a local pharmacy, or do they mail them to you?
No, right.
Right.
Well, I get one mail.
Okay.
For the leukemia.
Okay, we'll get to that one. Perfect. And so this one here is the lansoprazole. It's 30 milligrams, and you take that just once a day?
Right.
Okay. And do you know why you take it?
Acid reflux.
Good. Okay. Does it seem to help?
Yes.
We'll keep track of these medications. They'll actually be on your personal health summary that we send out.
Okay.
So, okay, and then this one is your metoprolol. It is a 50 milligram tablet that you take just once a day. Very good. Okay. Have you been taking these medications for a while?
Yes.
Okay. Now with metoprolol, sometimes it can lower your pulse or your heart rate. So I always advise patients to, if you feel a little bit tired or just weak, more than normal, check your pulse, either, feeling it, or if you have a little blood pressure cuff, or you can feel it here. If it's less than 60 beats a minute, you might want to ask your doctor if they want you to hold the medicine, because it can actually drop your blood pressure a little, or your pulse a little lower, which increases your risk to pass out or to fall. Right. Now, do you check your own blood pressure at home?
Yes.
Okay, good. And I'm going to do that today as well. And this is your amlodipine. It's a 5 milligram tablet, typically taken for blood pressure as well.
At night.
At night? Okay. And do you have any difficulty affording the cost of your medication?
No.
Okay. We're very blessed we have generic medicines today. For most of the
Yes.
time it can help us, which is good.
Now the cancer medication I had, it was very expensive.
Yeah. Did you get any support for that?
Yeah,
Any help?
we did. I went to MD Anderson.
Okay.
I didn't take chemo
Okay.
and go in a study.
Okay. And this was for leukemia?
Leukemia.
Any specific type of leukemia? CMF?
CML.
CML. Perfect. And what is the medication that you take for leukemia?
Gleevec.
Is that an injection or a pill?
It's a pill.
Okay. And how often do you take that?
I take it once a day.
Once a day.
And I'm on 200 milligrams.
200. Okay, I'm going to add that in. And you are in remission?
Since 2001.
Oh, wonderful. That's good news. Now, this atorvastatin is for your your cholesterol and your lipids. Okay, and do you take this one at night?
Yes.
Good. I'm glad you do. You know, your body actually makes cholesterol at night when you're sleeping, so that's the best time to take it. And when is the last time you had some blood work done to check your cholesterol?
I will have 6 months ago, probably cholesterol, but I will have it in September.
Good. So about twice a year.
Yeah.
Good.
I go to Evans every 6 months.
Okay, very good. And then I noticed that you're taking a baby aspirin, 81 milligrams. Is it every day? Okay. Is that just for preventive for your heart?
Yes,
Okay.
I have stents. I have
Stents,
2 on
okay.
each side.
And did you ever have a blood clot in your leg, in your
No.
lung? Ever had a stroke or a mini stroke? No. Good. And Donna, do you have any questions or any concerns about the medication that you're taking?
No.
Okay. Thank you for having that prepared. It's very good. Now, do you put your medicine in a little pill dispenser for the week? You know, that separates the days?
I have a drawer that I keep it all in.
Yeah, and you just take it out every day. Perfect. Okay. Medicare has initiated a new guideline as far as disposing of medications, whether they're prescriptions or over the counter.
Okay.
So I'm going to list 2 local pharmacies that are within 10 miles from you that take back drugs. So even if you have Tylenol that's 10 years old, they used to say throw it down the toilet or throw it in the garbage. They don't want you to do that anymore. It's not environmentally safe. So
I know Frick does.
Oh, perfect. Good. And that's close for you.
Yeah.
You can scratch out the name with a marker, put them in a Ziploc bag, you know, collect a few of them, and when you're ready, you can drop them off. Yeah, but I'll list a couple here too that'll be on your personal health summary. So that's good that you know that already. We're almost done here with the questions, and then I'm going to do a little checkup with you. I know about your cataracts. I know about your heart stents and your back surgery. Are there any other major surgeries that you had done?
I had a hysterectomy.
Okay. And how about a hospital admission for being ill or in an emergency?
Just the heart.
Okay. Yeah. Do you have any upcoming procedures scheduled?
No.
Okay, great.
Just my visit with the oncologist. And I worked with him too, so.
Wonderful.
Yeah.
Okay, are you currently experiencing a lot of fatigue or weakness?
No.
Good. Okay, any dizziness or passing out?
No.
Okay, good. How about any sleep disturbances? You take anything for sleep at night? Insomnia?
No.
Good, okay. Any night sweats, fevers, chills? And you said you exercise about an hour, 3 days a week, probably more with the stuff you do around the house here, which is good. Okay, and then any family history of diabetes. And when I say family history, I'm talking about your immediate family, so your mother and father or your brothers and sisters.
No.
Okay, and you currently don't have any symptoms of prediabetes,
No.
excessive thirst. Good. How about thyroid? Have they ever checked your thyroid?
They did.
Okay, everything's
It's
good. You
fine.
don't have to take any medicine for
No.
that. Okay. Do you have any allergy problems, sinus drainage, headaches?
Oh, I have allergies.
Yeah. Do you ever take anything to help, like a nasal spray or over the counter?
No, not really.
Okay.
It's just
Seasonal?
like seasonal.
I've always been told that over the counter nasal sprays, and you can check with your doctor, but sometimes that's all you need just to help with the inflammation and prevent the sneezing. So you can check into that as well. What was your last eye exam?
I had cataracts removed.
Okay.
Around December, something like that.
Of this year?
Yes.
Both of them?
Yes.
Good. Did it help?
Yeah.
Everything looks so
I
much
think
brighter,
so.
right?
My husband had his done. He doesn't think so.
Oh.
Okay, whatever.
But you definitely noticed. Good.
Yes.
Okay.
And I have an appointment. I think it's in October.
Okay. Any chronic eye conditions? Glaucoma, macular degeneration?
I have the start of macular degeneration.
A wet or a dry? Did they ever say if it was a wet or a dry?
He just finally said the last time he saw something.
Okay. And is he requiring you to do anything about that right now, or just watching it?
Just the vitamin.
Vitamin? Remember what it is? I'll put it with your meds. Vitamin.
I have it. Do you want me to do that?
Yeah, we can get it. We can get it at the end. When we get up and get your weight, we'll grab that. But I'll definitely add that in there since you're using it as preventative. So that's good that he started you on that. Very good. Okay. Any family history of asthma?
I had asthma.
You did? Okay.
Yes.
You ever take anything for it?
I took allergy shots and everything.
Okay.
I went
You don't have to do that
allergist.
now, though.
No.
Okay.
No.
Any inhalers?
No.
Good. Any coughing or wheezing?
No.
Okay. Shortness of breath with exertion?
No.
Good. You ever diagnosed with tuberculosis?
No.
Okay. And did you ever use any tobacco products?
No.
Good. Good girl. All right. As far as your heart, I know you've had some surgery, so a little bit of coronary artery disease. You've had a couple stents put in.
Yes.
And when was your heart attack? Do you remember what year that was?
I'm going to say maybe 5 years ago. I'm not sure.
Okay. So maybe around
I've had no
2019,
trouble.
2018, 2019. Okay. Do you ever feel a palpitation or a
Probably
flutter?
longer because
you
you
think?
know how.
Time goes so fast.
Yeah.
That's okay.
No, I don't. I don't have any problems at all.
How about any leg pain when you walk in the back of your calves?
I have sciatic,
Okay.
and all I do is exercise for it
Okay, good.
every day.
And I'm going to do a nice checkup, but you don't have any swelling. It looks like that's not something that's common. Okay. Do you get any chest pain?
No.
As far as your GI system, do you feel like you have a normal bowel movement?
Yes.
Almost every day? Okay. Any constipation or diarrhea?
No.
Good. Any difficulty digesting your food, meaning you might eat it and then you feel like you regurgitate? Other than a little bit of acid reflux, which is controlled with the medicine. And when you look at your colon health, have they ever ordered like a Cologuard or a FIT test where you do the stool sample to send in?
No, I haven't sent in, but I've had the scopes done.
Oh, okay. About how long ago was your last colonoscopy?
Maybe 5 years.
Wonderful.
They don't like to do them after
I
you're so
know,
old.
definitely.
and I'm
Well, you're not
there.
that old, but I understand. They say that the lining thins as we age, so
Yeah.
there's a risk of
But I
through.
just saw more not too long ago.
Wonderful. And you don't notice any dark stools or blood in the
No.
toilet? Okay. I always tell everybody, before you flush, turn around
I know.
and look at it and just make sure. Did you have that done at Frick?
Greensburg.
Greensburg, okay. Any hernias in the belly or in the groin area?
No.
Okay. Ever been diagnosed with a liver disease?
No.
And then as far as urination, do you find that you have any frequency or urgency? Gotta go,
No.
or I'm gonna leak.
No.
Okay. Do you need to wear a little protective pad in your underwear? Do you ever get up at night to go pee?
Oh yeah.
Okay, about how many times would you say?
Maybe 2 a night.
Okay.
Maybe one or two.
Are you able to go back to sleep?
Yes.
Good, good. And how about you or anybody in your immediate family ever have kidney disease? Stage 2, stage 3, stage 4?
I
on
have
dialysis.
starts to that too
Okay.
because of my medication.
Okay. Are you in a stage 3, stage 2? Did they ever tell you?
3
3?
maybe.
Okay. And I know they do watch that with blood work, and sometimes they'll ask you
Dr.
to avoid
Evans.
certain things in your diet. Good. Okay. Let's talk about your bones and your muscles. Obviously, as we age, we all tend to get a little bit weaker. And I tell everybody, Rome wasn't built in a day. So maybe you could do your whole house cleaning in one day when you were 20, but now it might take you 2 or 3 days, and that's okay, right? You do a little bit, you take a break. And do you find that you have arthritis in your joints anywhere that bother you? Your thumbs. Do you have a squeeze ball, or do you take anything like a Tylenol
I
or
just
anything for pain?
exercise my hands.
Yeah, and you have what they call those Herbinin notes.
Yeah.
Yeah, so that's good that you're at least exercising
My
them.
mom and grandma.
Yeah.
There.
See what they gave you?
Nice of them.
Yeah. A little squeeze ball, or even putting some rice in a sock, like a tube sock if your husband has one, and warming it up in the microwave and just stretching it. Definitely keep them moving. But overuse can also make them hurt. So if there's something that you're doing where you're constantly, using that motion, that can make it a little sore. So do you ever take anything for pain? Tylenol, Aleve?
I only take Tylenol.
Okay. And that's just if you have a headache or any discomfort for your back. Okay. Did they ever tell you you had spinal stenosis or scoliosis with the spine?
No, but I had back surgery after I retired from lifting patients. I had 4 discs.
Okay.
I'll put
Add
it
that.
on.
I'll put that on your admissions. How long ago was that?
Oh, geez.
A long time. If you don't remember, it's okay. No
15
worries.
years,
Okay.
I don't know.
Did it help?
Oh, yes.
Good. I'll definitely give you some relief. Now, it's important after age of 65 to get a bone density test.
I've had them.
Good. It's been the last couple years? Okay. Did they ever say that you had osteoporosis?
My mom was good.
A little
He
bit of
said they were
deterioration.
good, yeah.
You're not on calcium or vitamin D over the counter?
I take vitamin D.
Okay.
Yeah.
Yeah, that's good. Every day?
Yes.
Usually it's 1,000 or
A
2,000.
chewable.
Chewable? Good.
I like the chewables.
They taste better. It's good. And getting a little bit of sunlight, it's
Yeah.
okay just to get about 10, 15 minutes of sunlight every day. That helps with vitamin D. Have you ever been told you had gout?
No.
Any chronic skin condition like psoriasis or eczema? Have you ever had skin cancer, Donna?
No.
Anybody in your family ever have a stroke or a heart attack in your immediate family?
My mom used to have TIAs.
Okay.
Yeah. And my dad had a heart attack. He was a coal miner in a black lung.
Oh, definitely, yeah.
Yeah.
That played on his heart. And then how about any numbness or tingling in your fingers or toes, that neuropathy?
Maybe if I'm leaning or
Right.
something like that.
But it's not constant.
No.
And would you say your balance is good? Do you ever use a cane or a walker? And how about bruising? Do you find that you wake up with
Yeah.
bruises on your arms or legs? Okay. And then as far as the leukemia, I'm going to put that in here that it's in remission. Have you ever been diagnosed with any type of cancer other than the leukemia?
No.
Okay. How about in your family, your mom and dad or sisters and brothers?
No.
No? Okay. Ever been told you had an autoimmune disease? Like celiac, rheumatoid
No.
arthritis?
My daughter tells me I have celiac all the time.
time.
She has it,
Yeah.
so she's good. You have to have it. But we
Oh.
were tested.
And everything was good.
Mhm.
Okay. And then as far as vaccinations, do you get a flu shot usually in the
Yes.
fall? Okay. So you would have had one last September or October?
I just had one for this year.
Oh, you already had it?
Mhm.
Oh, good. Wonderful. When did they do that? June? May?
A couple months ago
Okay.
we went.
Good. And then have you ever had any of the COVID vaccines?
Yes.
Okay. Did you have both of them?
I had two, yeah.
Okay. Any boosters?
I had one.
Okay. And if you have your card, we can get that and enter the dates. Sometimes it's nice to have those dates. If you have your COVID card, we can get that. And then how about a Tdap? Tetanus, diphtheria, and pertussis. It's a vaccination.
Yeah.
Not recently. Shingles vaccine?
No.
No? How about the pneumonia vaccine? I recommend that one.
I think I had one.
Yes. Usually it's a one and done unless you have a chronic
Yeah.
respiratory condition. Good. Have you been screened recently for any hepatitis, B or C?
No.
All right. And Donna, do you still require mammograms? Are they ordering those every couple years? Okay. Did you have one last year?
Yes. Every year.
Okay. And you don't need to have the cervical cancer screening anymore.
No.
Do they do any of that testing?
No.
Okay, and then when we look at your mental health, we typically like to ask patients how they felt the last couple weeks. If you've felt any down, depressed, lonely.
No.
You don't have time to be lonely.
No, I don't.
That's a good thing. Is there any family history of suicide, schizophrenia,
No.
bipolar in your immediate family?
Not that I know of.
Do you ever drink any alcohol?
No.
And ever been hospitalized for a mental health condition? Do you ever feel anxious or nervous? Worry?
I try not to worry.
Okay. That's good. Excessively, I think we all worry, especially being moms and grandmas, right?
Yeah.
But to the point where it affects your daily living.
No. I'm very much read the Bible.
Yeah.
Just count on.
Absolutely. You have ways and outlets to help relax
Yeah.
you and help with your faith. Good. And you don't take anything for anxiety or depression, no medication. Good. Do you ever miss having people around you, or do you always usually have somebody around you nearby?
We
Or
have a lot
family?
of
Yeah,
friends.
that's what I thought.
One good neighbor that we,
Good.
I bet we're together 4 times a week.
Wonderful.
Yeah.
So it sounds like you have enough people that you feel close to that you can rely on
Yeah.
with family and friends around. It's very good. All right, so let's talk a little bit about your health overall, how you're feeling.
Okay.
Your environment here looks beautiful. You keep a very nice home,
Thank
very
you.
clean. Do you do your own cleaning?
I do.
Yeah. You put your husband to work? He does the outside, huh? The grass.
He does the grass.
Okay.
I do the shrubs. And
and everything else. Yeah, you're a hard worker. You know, I like that you don't have any rugs laying around that you could fall on, and you know, there's nothing that you could trip on the floor, so that's good. And everything's pretty much one level for you. How about a smoke detector in the house?
We have them over.
Okay. Is it battery operated?
Yes.
Good. I always say change it when the clock goes forward and back. Change your battery too, just so that it's up to date. And you bath and dress yourself.
Yeah.
Okay. And you help prepare meals. No assistive devices, which is good. Okay. And then your nutritional health. Typically, you know, as we age, we don't need to eat as much. Do you find that you eat 3 meals a day? Do you eat?
I don't eat as much as I used
Do you
to.
graze a little bit all day? Okay.
No,
Or do you eat?
I just eat my meals.
Your meals, okay, but smaller portions.
Mhm.
Good. And do you get enough variety of protein and calcium?
I do. I'm not good at protein
Okay.
because I don't like meat.
You don't like
that
meat.
much.
Yeah. How about chicken or turkey, peanut butter, beans?
Peanut butter.
Good, definitely. Okay. And
I'm not a meat
you're not a
eater.
meat eater. That's
No.
okay. How about fruits and vegetables?
Yeah.
Do you have all of your teeth or a denture at all?
Just a cap.
Caps in front, and you don't have any trouble chewing or swallowing?
No.
Perfect. And your husband, what's his name?
Herb.
Herb. Do you guys eat together normally most
Oh,
nights?
yeah.
Okay.
And out a lot.
Yeah, that's okay. Sometimes it's cheaper to eat out.
Yeah.
Have you lost or gained more than 10 pounds without trying in the last 6 months?
No.
Okay. Your weight's been kind of steady.
Mhm.
Good. Okay, Donna, this next section is a little bit about fall risk. I'd like to see how you do when you stand up and watch your gait and watch you walk back and forth. So it's a timed up and go test, so I'm going to time you while you walk.
Okay.
What I want you to do is stand up and get your balance, and then just normal pace, walk about 10 steps, probably to the end of that carpet, straight line,
All right.
turn around and come back, and then just sit back down. So
Okay.
whenever you're ready, you can do that.
Okay.
Perfect. That was about 9 seconds. So that was really good. Your gait was normal. You didn't seem to sway side to side, and you felt pretty good with your balance.
Mhm.
Good. So if it was greater than 12 seconds, that would put you at an increased risk for falls.
Okay.
Anybody can fall. I always tell the
Right.
story. I got up one night, my pillows were all on the floor, and I went to go to the bathroom, and I tripped on a pillow. I came about this far from hitting my head on my dresser, and I thought, oh my gosh, how scary that could be. And I teach my patients about fall risk and safety,
Right.
and I'm not picking up the stuff on the floor. Good thing to keep a nightlight on in the hallway or near the bathroom. When you get up out of bed, you should always sit and dangle your legs for a few seconds, and then when you stand up, wait a few seconds before you take off.
Okay.
So that's always a good best practice just to prevent falls.
Okay.
But you did great.
Thank you.
Okay, Donna, you did great with all of your questions and history. I'd like to do a physical exam with you, if that's okay. I'm going to swing around here. And, is it okay if I use a little hand sanitizer? Does that bother you?
Yeah.
Okay, so I'd like to check. We're going to check your oxygen level. This is a pulse ox. Just hold real still for a minute there. Would you normally run a lower pulse heart rate?
Yes.
Yeah.
Mhm.
Yeah. So you're at 98% oxygen on room air, and that is good. That's normal. You don't wear any oxygen at night to bed, do you? Okay. Your pulse is hanging right around 48, 49. That is a little lower, but that's normal for you?
Mhm.
Okay. Perfect.
Now the blood pressure's a little off. Just don't pay attention.
Did you take any of your medicine yet today?
Yes.
Okay, perfect. And I typically use the left arm if that's okay with you. A couple different sizes of cups.
That's good.
Some are bigger, some are smaller. Good. And you can just relax your arm there. So I got 140/68. It's not bad. I am going to repeat it in a few minutes after I do the rest of your exam. We'll see if that top number comes down a little bit. You don't have any headache or dizziness right now?
No.
Okay. Dawn, I'd like you to look straight at me. I block the light a little bit. Perfect. Okay, and I'd like you to follow this with your eyes. Don't move your head. And then straight to your nose. Perfect. And Donna, can you give me a big smile? Good. Stick out your tongue. Puff your cheeks. Raise your eyebrows. Good. Can you turn your head to the left and to the right? Good. And are you able to look up? You have full range of motion. And one more thing I'll check while I'm here is, can you squeeze my fingers? Good. Pull me real hard towards you. Good. Now push me back. Good. And then can you stick your arms out in front of you just like this? Just checking for any tremors. Good. You're nice and still. That's perfect. And you have full range of motion. You can reach up and wash your hair in the shower. I'm going to check your thyroid gland, and I like to come from behind. So if you would turn that way. Okay. And then you'll just feel me push and let me know if anything's tender. Good. Can you swallow for me? Good. I don't feel any lumps. It doesn't feel enlarged, so that's good. And while I'm here, I'm going to listen to your heart and lungs. Good. And just breathe nice and easy. And then I'm going to listen to your carotid arteries. So if you could hold your breath for a couple seconds. Good. And then the other side, hold your breath. Good. They sound nice and clear. Now let's check your lungs. I'm going to come up underneath. Give me a nice big breath in and out. Perfect. You sound good. All right, Donna, I'm going to look at your lower extremities. May I have you take your socks and shoes off, please? Do your feet get cold?
I get cold all over.
All the time? Yeah. And you don't have a lot of swelling, which is good. So typically, you know, if you push your finger down and it stays a little bit, you do have a little bit right in there, but nothing significant. Do you watch your salt?
No.
You don't use too much salt?
No.
No, good. Okay, and I'm going to check your sensation in your feet. So I want you to close your eyes, and I want you to tell me where you're feeling me poke. Good. Middle. Good. Good.
After the toes.
Yeah, right below the toes.
Yeah.
Good.
Feel.
Good. Okay, let me try this side. I'm going to feel your pulse. And just a little bit of swelling, but nothing that's bad. Do you elevate your legs sometimes or sit up? Good. Wiggle your toes. Good. Your toenails are beautiful. Nice. Do you cut your own toenails? Okay. All right, close your eyes for me. Tell me where you feel.
Big. Middle. Middle. Feel. Almost.
Yeah, good. You have good sensation. You can keep this as a souvenir.
Oh, gee,
I always tell everybody, keep it in your bathroom. If ever you start to feel any burning or numbness or tingling, it's always a good way to check.
Okay.
They call it a monofilament test, but you have
Okay.
very good sensation. May I help you put your socks
No,
and
I
shoes
can
back
do
on?
it. I can do it.
Dawn, I'm going to go ahead and measure your height. How
Okay.
tall do they normally measure you?
5 feet.
5 feet. Okay, stand nice and tall for
Okay.
me. You're going to feel me hold this by your foot here.
Okay.
Yeah, about 4'11", just a little under 5.
Okay.
Okay, and I'm going to zero this. And when it goes to 0, then you can step on there. If you need to hold my arm, you can. Whoop, there you go.
Okay.
Good.
Okay.
Okay, so let's punch that in here.
Okay.
Good. And you have a BMI of 23.2, which is in the normal range.
Good.
So very good.
Thank you.
So I do have some testing to do that the health plan has assigned for you today. So the first test that I want to give you is what's called a FIT test. This test is a test that's going to test you for colon cancer. It does clear you for a year. So what you're going to do, and there are instructions in here. There's a tissue paper in here. You're going to take and lay that down on the water. You're going to go ahead and have your bowel movement on top of that tissue paper. It's going to keep it up out of the water for you. Then you're going to use this little swab that's in here. Swab has a little brush end to it down at this end here. You're going to take this off. It just kind of twists off. Pull it out. Swab the stool. Make sure that tip is nice and covered there. And then you're going to put it back in here, taking care that you don't spill the liquid that's in this tube out of it, okay? That's all you have to do. After that's collected, you're gonna wrap it in this pad that's in here, put everything into the biohazard bag, and then use the envelope that is in here as well to send it back by regular mail, okay? So that's pretty simple. Let me fill out the paper here for you real quick. Put this this barcode in. So they do ask that you return these in about a 7-day period, okay? So you'll send the paper back along with the specimen, all goes into that envelope that goes in the mail. And again, it's just through regular mail, okay? I'm gonna put it all right back in the box here for you so you have everything. And then I'm gonna leave that with you, okay? All right. So the other two tests that they have for me today is what's called an A1C. So it's a number that looks at your diabetes to see what level of control you're exhibiting for the diabetes, okay? It's gonna just be through a little finger stick, no big needles or anything like the doctors do, okay? Also, while we're getting that blood specimen, we're also gonna do what's called a KED or a kidney evaluation based on your diabetes. So what I do need for that is a urine specimen, and then we're also gonna get a blood specimen, okay? So I'm gonna go ahead and give you the urine cup now. Do you think you can give me that specimen? Perfect. I'm gonna go ahead and have you do that.
Here you go.
Oh, perfect. You can set it right here on this pad. I'm gonna go ahead and get that urine specimen now. So I'm gonna use my tube.
Okay.
And it's pretty simple. I just suck it up like this. So that's ready to go. All right, so now we're gonna go ahead and get your blood specimen, okay? So I'm gonna get 2 specimens, hopefully from just one little finger prick.
Okay.
To do your A1C and the urine component of that kidney evaluation test, okay? Can I see a finger here?
Does it matter which?
It does not.
Okay.
One, I think, let me use one of these ones
Okay.
here. There, and then we're gonna flip your hand and get the rest, okay? Ready? 1, 2, 3, little pinch. Sorry about that. And get a nice little bubble here. Now I'm going to have you flip your hand over. We're going to work on dripping some blood onto this little card here. I'm going to try to get about 4 big drops. I'm going to do one more and then I think we're good.
Okay.
Perfect. Just going to have you hold that on there a second. I'm going to put a Band-Aid on because sometimes once I squeeze for so long, they do bleed a bit. So we'll put the Band-Aid on for you. And I'm going to go ahead and get that A1C. I already have the specimen, so we're just going to put this little guy in here. And I'll have your A1C result in about 5 minutes.
Okay.
All right, so I'm just gonna get this stuff packaged up. I'm gonna grab some barcodes here. Perfect. Pull out your paper. So once I send this off in the mail later today, in a couple weeks, they will contact you regarding your results. It'll come in the mail, so just be on the lookout for that. Your doctor will also get a copy, so he'll know what their test results were as well. I did get your A1C result as well, and that came back at 5.0, which is great, okay? So another test that the insurance company ordered for you today is what's called a DRS exam. So it is an exam that takes some pictures of the very backs of your eyes to make sure there's no problems with your eyes related to your diabetes. It's going to look for things like bleeding and swelling. It's very important because those can lead to blindness as a diabetic if you're not careful, okay? So to do that, I do have to have you put on these little sunglasses. They're going to help dilate your eyes, and they're just going to wrap around your head. You shouldn't have to hold them at all on there, okay? And then about 5 minutes or so, we'll take the pictures after your eyes have had a chance to dilate. Okay, so I'm going to go ahead and have you take those glasses off, but I want you to keep your eyes closed for me, okay? Perfect. So I'm going to go ahead and get my camera lined up, and then I'm going to have you open your eyes, okay? So keep them closed for the moment. All right, so we're going to come in. All right, go ahead and open your eyes for me. Perfect. Can you tell me, do you see a plus sign there? Excellent. I want you to open your eyes real wide. Keep them open. I'm going to take picture. It's going to be a real bright flash, okay? So go ahead and close your eyes again. The camera is going to make me wait about 30 seconds so your eyes can even out again, and then we're going to take a picture of the left. Okay, the 30 seconds is up, so I'm going to bring it back up to your face here. We're going to use your other eye this time. I'm going to go ahead and have you open that eye. Open both eyes, nice and wide. Good. Do you see a plus sign now with that left eye?
Yes.
Perfect. I want you to look right at that. Keep that eye nice and wide open for me. Perfect. So I do like to show people the pictures that I've taken. So this is the picture of the very back of your eye. So this is your optic nerve, which is the nerve that gives you vision. This is a dark spot. That's the very back of your eye. That's supposed to be there. And then these are the blood vessels. For me, that's all I'm looking at on these pictures to make sure I have those three things. An actual eye doctor will read these and let you know if there's any problems, okay?
Thank you.
You're welcome. So now that we have your shoes and socks off and have you in a reclined position, we're going to do this last test here, testing for what's called peripheral artery disease. So it's a test that's going to look at the blood flow from your heart down to your toes to make sure there's nothing blocking that circulation down your legs, okay? So to do it, I'm just going to use this little clip. I'm going to put it on all of your extremities. We're going to start by placing it right here on your finger. It's going to take about 15 seconds to read, and then we'll move on to the next hand, okay? Perfect. We're going to go ahead and move to this hand. There you go, just like that. And again, 15 seconds. Perfect. Now we're going to move down to your toes. There we go. All right, hold that foot nice and still for me. Now we're going to move to the other foot. All right, so we're all done with that. Let me just save and I'll get you your results. So it looks like the results do show that you have some mild decrease in the blood flow to both legs, okay? So that being said, what you want to do when you have that is just to make sure that you're controlling your risk factors. So that's things like controlling your high blood pressure, your cholesterol, your diabetes, making sure that stays controlled, and staying as active as possible, okay? Perfect.
This is your personal health summary. Also is attached as my business card.
Okay.
So if you need to reference my name, this is the Matrix main line number. And then this is a thank you for the visit. Important reminder that your annual wellness visit with your doctor should still be completed if you haven't done that yet.
I did.
And it takes about 2 to 4 weeks to get the personal health summary in the mail. And then your primary care doctor will also get a copy of our report. Okay. I did leave you some notes back here. I would like you to talk to your doctor about getting an advanced directive set up.
Okay.
That way you have your wishes and everything is in place for whenever you need that. There's your blood pressure, your pulse, your respiration, and your oxygen. Everything else is up to date. As far as your vaccinations and all of your testing. We hope that we get to see you again next year.
Okay.
There is a number down here if you would need to call Matrix, but if we call you again next year, you'll at least know who we are, and maybe I will get lucky and get to come and see you again.
Okay.
I would love to
That'd
see
be
you again.
great.
Yes, that's for you.
Thank you.
This is your prescription medicine, tips for storage and disposal, like we talked about. You seem to already know that Frick Hospital has a drug disposal location, so you're welcome to bring that there. But this is just a general reminder for you. And then the two closest places. Most CVS pharmacies, which I know there's one down the road here,
Right.
They all do that as well. So I wrote Frick and CVS on there
Okay.
for you.
Okay, thank you.
You're welcome. And a couple last minute things here. You just pull this up. And I don't need to send a care management referral to your health plan at this time, so they will probably will not have to reach out for anything. This is an attestation, your signature, that a nurse practitioner came here to do your visit, so you're just attesting that I was here to do your visit. So I'm going to have you sign just with the fat pad of your finger. Don't rest your hand down, just like this. Perfect, Donna, thank you. And then your ethnicity, Caucasian white. Okay, and the highest grade level that you completed. You had college, 2-year, 4-year?
I had college with this, RN with associate.
Yeah, wonderful, perfect. And then just reviewing your diagnosis page, there's nothing that pops up that's that we haven't discussed already in your visit. But if you get your personal health summary and you see that there's an error or a mistake, you can definitely call that number and we'll get that fixed for you.
Okay.
But everything else should be ready to go. And we'll definitely send a copy of this to your primary care doctor. So do you have any questions or concerns for me?
Okay.
Okay, wonderful. Well, it was nice meeting you. You
Nice
take
meeting
care.
You too.
So Donna, this next section I'd like to talk about is social determinants of health. Are you currently married?
Divorced.
Divorced, okay. Are you living here by yourself?
Yes.
Good. Do you have any children or family around?
Two, but they're out of state.
Out of state, okay. So do you feel in the last 12 months that you've been living in a stable condition? You've been able, to pay for your rent and your utilities and your food?
By the time I pay the utilities, I don't have enough maybe for food.
Okay, so you struggle with that. Is that recently or has that been going on for a while?
Oh, wow.
Okay. All right. Let me show you. I have an app on here. What is your zip code?
15666.
Good. And let's look. And maybe you know some of this already, or I don't know if you've tried to find any local food banks or the Meals on Wheels. Have you heard of any of those around here?
I've heard of them.
Okay. Would you be okay if I give you some resources
Sure.
and maybe that could help sort of supplement with your food supply each month? So let's look at food pantries, because that's always good, because those are free and usually they offer a food pantry once a week, sometimes once a month. And do you drive? You can
Yes.
take yourself to the location? Okay. So you can see here this food pantry at the Mount Pleasant Church of God. There's an emergency food assistance resource. Do any of these look familiar? Drive Up Distribution. There's St. Vincent, the Paul Food Pantry.
I know the Mount Pleasant Church.
Okay. Do you think you'd feel comfortable going to this place? I can put the number down and we can find out what the schedule is.
Okay.
Yeah, anyone in need, all ages, individuals, and family. The cost is free. I'm going to put the number here for you. You can follow up and see what their hours are. There's also a website, but it might be easier for you to just call, and it's only 3 miles away from you. So that would be really nice.
Yeah, we're close.
Yeah. If you'd like me to call, I can, just to see, what their hours are, or if you're comfortable, you may call as well.
Okay.
I'm looking to see if it doesn't give the days that they distribute, so you may have to call. It just says it's closed on Tuesdays, and it looks like they're open, closed today, I'm sorry. They're open on Tuesdays from 9:30 to 11.
Okay.
The other days they're closed. And then what about Meals on Wheels, where they deliver some food to you? Would you be interested in something like that?
Yes.
Okay. So we have that number here too for the local Meals on Wheels. I think that's a great program. You can see there's a lot of different types of home delivery meals here. Here's Meals on Wheels. We can start with that one.
Okay.
And then if you reach out and let them know where you live and your situation. They could probably tell you what days they deliver and see if you're eligible.
Okay.
We'll get you started there. Okay, so I have two locations. Well, at least we can start with that Mount Pleasant Church of God, and then the Meals on Wheels, and hopefully that may help a little bit.
Okay.
Do you feel comfortable with all of your other utilities and bills? Your house is paid off?
Yes.
Okay. Okay, well, hopefully we can help you get
Okay.
some, at least support with that.
Okay,
Yeah,
thank
you're
you.
welcome. Donna, are you okay?
I just have a really bad headache and I'm dizzy.
Oh, goodness. Yeah, I can tell in your eyes. You don't look like you feel good. When did it start?
About an hour ago.
Oh, my. Okay, well, I'm glad I'm here. I'll tell you what. Before we start some of these questions, let me go ahead and just check your vital
Okay.
signs and see how you're feeling here, and
Okay.
we'll go from there.
All right.
What is your birthday? Good. Okay. All right. Let me grab my stethoscope. I'm sorry you're not feeling well. Did you take any blood pressure medication this morning?
I did take my regular.
You took your regular
Yes.
medicine. Okay. All right. May I use this arm? Is that okay?
Sure.
All right. Let's see here. Yeah, it's very high. Do you mind if I check the other arm as well? It's up to 190/96.
Okay.
Has it ever gone that high?
No.
Goodness. That would explain the headache.
Yes. And the disease.
Yeah. Have you ever had a stroke or?
No.
Okay. Let me check this side too, just to make sure. So this side's a little better, but it's still elevated, 188/92. Let me check your pulse. If it's okay, I might give your primary care doctor a quick call.
Okay.
All right, your pulse is a little low. Is that normal for you? It's down to
Yes.
48. Okay,
Mhm.
oxygen level looks good. Before we start, I'm just concerned since you're so symptomatic. I'm going to give your PCP a call. Who is your doctor?
Dr. Means.
Okay. Do you know the number off the top of your head? I can look it up. Okay. Let's see here. Do you have any family nearby?
No.
No? Okay. And when was the last time you had an appointment with Dr. Means?
A couple months ago I saw his PA.
Okay. And what medication are you taking right now? Do you remember the name of it? Like a metoprolol?
Metoprolol.
Okay, you take metoprolol? Okay. Amlodipine, any of those sound familiar? Or just that one?
The one.
And the aspirin? Any aspirin?
Yeah. And I
Okay.
take a 5 milligram at night and I'm not sure.
Okay. That's okay. We'll look into that. Okay. Hi, yes, this is Danielle Mohar. I am a nurse practitioner with Matrix Medical Network. I'm here doing a home visit with Donna Barkley, and she appears to be in a little bit of distress. Her blood pressure was 198/94, and on the other arm, 188/92. She has a headache and she's very dizzy. She said it started about an hour ago. She did take her medicine, yes. Do you have any way to get to the emergency room?
I drive, but
Yeah, we don't want you to drive.
dizzy.
Okay, yeah. There's no family around right now. Yeah, okay, that's what I'll do. All right, thank you so much. Bye-bye. So they want you to go to the emergency room to be evaluated.
Okay.
So I'm going to call 911 and have an ambulance come and assess you and then take you to the nearest hospital.
Okay.
And that's Mount Pleasant? Frick.
Yes.
Okay. I'm actually using my Alert GPS app. We have a safety app, and they can connect us with the ambulance. Hi, yes, I'm okay. Thank you. This is Danielle Mohar from Matrix. I'm out doing a home visit with a member, and they want us to send her to the emergency room. I just called her PCP. She has an extremely high blood pressure, and she's dizzy and has a bad headache. And we wanted to see if you could get us an ambulance. Yes, I will stay with her until they arrive. Okay, thank you so much. Okay, they're sending somebody on the way now, and I'm going to stay here with you.
Okay, thank you.
You're welcome. Okay, Donna, so we're going to review some of your medications. First of all, do you have any drug allergies that you're aware of?
Penicillin.
Penicillin, okay. What happens when you take that?
I got a rash.
Got a rash, okay. So hopefully avoid taking that again, huh?
Right.
Good. Okay, and then these are the medications that you take?
Yes.
Okay, let me look at this one. And this is your metoprolol, 50 milligrams, and you take that once a day?
Yes.
Okay.
In the morning.
Good. Okay. And, oh, this one's also metoprolol, 50 milligrams. Do you take it one in the morning, one at night, or?
No, I take one.
One a day.
I just got one in the mail, from the pharmacy.
Oh, okay. Have you been taking one from each bottle?
I could.
Yes. Oh my. Okay. Maybe what happened was you didn't realize you already had this in here, and then you added it to your collection.
Yes.
So I'm glad we caught this because that can drop your pulse and make you dizzy, and maybe even slow your heart rate down. So yeah, let's maybe put one of these away in a cabinet. You know what's really helpful? I use for my daughter. She takes medication, but I have a weekly pill dispenser,
Yes,
the little
I've seen
caps.
them. Mhm.
Yeah, they're really cheap, couple dollars at the drugstore, but it's nice maybe each beginning of the week on Sunday you fill all of them and then put your bottles away, and
Okay.
that might help, but I'm glad we caught that. So here, maybe take that one and we'll put it aside so we can put that back in your
Okay.
closet.
All right.
Okay, and then your other one's good. This is your amlodipine. Okay, and that's for your blood pressure.
Mhm.
Any problems taking that?
No.
Okay. Yeah, so you were taking technically 3 blood pressure pills.
Yes. Instead
Yeah,
of the two.
okay. All
Okay.
right. And have you been feeling okay? Side effects?
I didn't realize any.
Okay, good. Thankfully we caught that. And then this is your baby aspirin, so that's good. And that's all you take right now?
Yes.
Okay, perfect. All right. Do you have any questions about your medication?
No, not now.
Okay, all right. Well, good. I'm glad we caught that.
Yes.
No worries. Good. All right. Well, you don't take too many. That's good.
No.
Some people take a lot of medicine, so
I know.
hopefully we'll put that one away and
Okay.
get yourself a little pill dispenser to use Monday through Friday, or
Okay.
Sunday through Saturday, I guess. And hopefully we'll get that straightened out for you.
Okay.
Okay, I'll
Thank
put that
you.
in your notes. Buy a pill dispenser for weekly. Okay. Okay, so Donna, do you have a primary care provider that you see?
I do. I haven't been there for a good while.
Okay, that's a good while.
Maybe around 2 years.
Oh,
I don't
no.
know.
Oh, goodness.
1 or 2 years. I don't
Okay,
know.
is there a reason? Do you have transportation
I
problems
just
or?
don't feel real comfortable with him. So.
Okay, okay. Well, I would really like to get you established with somebody. Are
Okay.
you familiar with anyone else in the area, or would you like me to maybe see who's available that we can get you set up with?
Yeah, you can do that. I do like Dr. Means.
Dr. Means,
No,
great.
yeah, so
Okay,
if you
well, why don't I call while you're
Okay.
here and let's see if he's under your plan
Okay.
and maybe we can get you set up with an
Sure.
appointment. Would that be okay? Because
You
I'd
need
really
my-
like to get you in.
Need my
Yeah,
card.
that'd be great. Okay. Sometimes you're on hold for a few minutes,
I
so.
know.
Second in line.
There you
That's
go.
good. Hi, yes, my name is Danielle Mohar. I am a nurse practitioner with Matrix Medical Network. I'm doing a home visit with Donna Barkley, and she needs assistance with finding a primary care provider in her area. The current physician, she hasn't been there in 2 years, and she's not comfortable going back there. Would you be able to help us to find a primary care doctor in the area that's covered? She did mention there's a Dr. Paul Means that she would maybe consider going to. Sure. What's your date of birth?
8743.
8743. Mm-hmm. Yep. And the ID is MMP263W08542. Yes, and she's here with me. Say hi, Donna.
Hi.
Oh, great. Dr. Paul Means is listed as an option for you to see. Okay, perfect. I will give the doctor's office a call and see if we can get her a new patient appointment. Nope, that'll be all. Thank you for your time and your help. That was quick.
Yeah.
All right, so let me call Dr. Means's office. Let me look it up. And is it okay if I try to get you a new patient appointment?
Sure.
Okay, and do you have a way to get there?
Yes, I
Yes.
think I can get a neighbor to take me.
Take you. Okay, okay. Hi, yes, my name is Danielle. I'm a nurse practitioner with Matrix Medical Network, and I was calling. I'm with a member here, Donna Barkley, and she is wondering if she can get a new patient appointment with Dr. Paul Means. Okay. It's 3 months out for his schedule, but they can get you in with a PA initially,
Okay.
and then put you on his schedule. Would that be okay?
That'll be fine.
Yes, she said that would be great. Okay. Next Friday,
Okay.
morning or afternoon is better for you. Morning?
Mhm.
Okay, she said morning. 10:30?
Sure.
Okay. And bring her insurance card and her ID. Perfect. Okay. I'll let her know. Thank you. They'll call you the day before to remind you of the appointment.
Okay.
They have you in with the PA initially just to get you in sooner. Bring your medications with you, your insurance card, and your driver's license, your ID. And then they'll put you on with Dr. Paul.
Okay.
Yay,
Thank you so
you're
much.
welcome. I'm so glad we could find you a doctor.
Yes.